I call the honourable member for Stretton.
Thank you very much, Mr Deputy Speaker. I wanted to commence by thanking all nurses in our community on International Nurses Day. The member for Greenslopes did a fantastic job of conveying the challenges that you face in a typical working day. I know there's many nurses in the gallery this evening, and I thank you all. Earlier today, I had the senior school captains and the acting principal from Stretton State College visit Parliament, and it was very heartening to know that one of the school captains, Michaela, intends to study nursing next year. It is a very worthy vocation, and it's fantastic to see one of our talented young people in the electorate of Stretton aspiring to become a nurse in the future. Mr Deputy Speaker, the Palaszczuk government made an election commitment to legislate for safe ratios and workload provisions to ensure better patient safety and better quality health care. And I'm very, very pleased to speak in favour of the Hospital and Health Board's Safe Nurse to Patient and Midwife to Patient Ratios Amendment Bill 2015, which will ensure that the delivery of health services in Queensland is safe and efficient. This bill should probably be seen as part of Labor's long-standing commitment over the past decade to deliver better health services to Queensland. I'm very proud to be a part of a government that is following the Labor tradition of improving health services to enhance the conditions of care for those most in need. I also want to congratulate the Minister for Health for all his hard work in this particular area. The objective of the bill is to establish a legislative framework to ensure safe nursing and midwifery staff numbers and improve patient outcomes through mandating nurse-to-patient and midwife-to-patient ratios and workload provisions in public sector health service facilities. There is clear research evidence that indicates that the number of nurses and midwives on a shift plays a pivotal role in the patient's safety and the quality of health services being delivered. Inadequate nursing numbers result in general patient care procedures being neglected. A higher percentage of nurses or midwives to patients reduces these adverse outcomes for patients by lowering patient mortality, preventing adverse events, decreasing the length of stay and reducing work-related injuries, absenteeism and turnover. One registered nurse can decrease patient mortality by 10%. We want to implement this legislation for mandated nurse-to-patient and midwife-to-patient ratios and workload provisions in the state's public health facilities. When implemented, it will enhance safe patient outcomes and ensure that resourcing is matched to patients' needs. The ratios will set the minimum nursing and midwifery numbers required to appropriately and safely manage service requirements. Their legislated use within the public sector will further support existing nursing and midwifery workload management frameworks and processes such as the Queensland Health Business Planning Framework Nursing Resources, along with professional college standards and good clinical judgment. The positive effect of this legislation is twofold. Firstly, it ensures a safer environment for the patients, and secondly, it provides an environment which enables the most effective delivery by nurses and midwives to their patients. The benefit of minimum ratios to patients receiving care and treatment are the improvement of patient safety and the quality of care. In turn, this reduces readmission rates and post-operative mortality rates. Minimum ratios also provide safer workloads for the frontline public sector nursing and midwifery workforce, which improves recruitment and retention, staff satisfaction and greater workforce sustainability. Mr Deputy Speaker, there was a great example in the committee report, and it's also been mentioned by a number of speakers about California. And I note that the member for Caloundra dismissed California. He said it was only one state. Well, of course, he's forgetting that California is the Golden State. It's the most popular state in the United States, and of course, Mr Deputy Speaker, the state of California had a very infamous governor, Arnold Schwarzenegger. And it's interesting to look, and it's a really interesting case study, particularly for those opposite who have so far spoken against this bill, to have a look at what happened when the Terminator took on the nurses of California. And I want to enlighten those opposite about what happened. So the Terminator, he came in as governor, and he started a year-long legal battle with the state's nurses' union over a state law that required more nurses in hospital. So Governor Schwarzenegger, he opposed a law which mandated that California's hospitals raise hospital staffing ratios, and he in fact went so far as to issue an emergency declaration blocking the new ratios. So what happened then? Of course, the nurses fought back, the people of California fought back. So there was a court fight. The California Nursing Association staged more than 100 public demonstrations against the Terminator. What did the Terminator do, Mr Deputy Speaker? Well, of course, he initially dismissed the nurses' protests against his emergency declaration as the work of special interests. But of course, he was later forced to dodge the placard-carrying nurses at public appearances, and even the Terminator ended up having to take rear entrances to public buildings. And to quote Rose Ann DeMorrow, Executive Director of the Nurses Association, everyone said you can't fight with this guy. And she said, if you look at how the campaign escalated, what started as a campaign to reduce nurses in hospitals turned into a statewide war. So what we have here, Mr Deputy Speaker, is a situation where the Terminator, he'd beaten the Predator, he'd been Mr Freeze, he'd been Conan the Barbarian, and the nurses got there. He fought against the nurses, and the nurses won. The people of California won. And so that's a very important lesson for those opposite, because there's been a lot of hasta la vista being whispered and even said out loud opposite recently. Of course, last week those opposites said hasta la vista to the member for Surfers Paradise. That's why he's sitting over there. And of course, then the member for Clayfield came in and he said hasta la vista to the member for Mermaid Beach. That's why the member for Mermaid Beach is sitting over there. So there's a lot of hasta la vista being said amongst those opposite. But of course, I'm sure the member for Surfers Paradise, at least in his quieter moments, says, "I'll be back. I'll be back," he'll be saying. "I'll be back." But there's so many of those opposite who no doubt have the view that he won't be back. He might say, "I'll be back," but he won't be saying, "I'm back, Mr Deputy Speaker." And can I say to those opposite, if you continue to oppose sensible, evidence-based reforms that benefit the people of Queensland, the health and safety of the people of Queensland, and support our hard-working nurses, it'll be hasta la vista to you as well. So take the lesson from California.
Order.
Take the lesson from the Terminator.
Member, order.
Madam Deputy Speaker.
Order. Member for Stretton. Member for Stretton will resume his seat. Order. You will direct your comments through the chair, and you'll stay somewhat closely to the business of the bill. I call the member for Stretton.
Thank you very much, Mr Deputy Speaker. As I was saying, this bill is a very positive step in our healthcare system towards ensuring health and safety for both patients and the nurses and midwives that provide their healthcare services. For patients, it will deliver the best possible outcomes and ensure their safety, and for nurses and midwives, the safe staffing load will empower them to deliver efficient healthcare services. It is an election commitment that has been made by the Palaszczuk government. We are committed to seeing it through so that public hospitals can be provided with safe and quality healthcare delivery. I commend the bill to the House.